Now I'm going to talk about construct validity, which is another type of validity, but it really goes under how do we measure things and how do we operationalize variables. And one of the really important parts about this is that we want to make sure that we're really measuring what we think we're measuring. And there's a lot of sort of issues with that. Again, we've talked about how your research questions very specific about what you're going to measure, and you've looked about independent, dependent, and control variables or confounding variables, and they're all great, but how are you going to measure those? How are you going to operationalize those is what we talk about. And it's really difficult because there are some problems with that. I'll give you an example. We used to, in the United Nations, measure happiness, and we'd look at levels of education, income, do you own a house, do you have health insurance, those kinds of things. And on that scale, the United States is really super happy, right? And it's before we had such income disparity, everybody was great. And we looked much happier than lots of other countries who had less of those things than we do. But that was based on how we were measuring happiness, correct? And one of the things that sort of was a clue to us, and this is sort of how you do come up with research questions, is that we also were a nation that had the highest level of people on antidepressants, and we had a higher level of depression than most countries, and we had lots of people on who were sick from work, and we had a lot of other issues that would say maybe we're not so happy. So that was an issue, and that was one of the reasons we came up with another study. And that study looked at maybe we're not measuring what we think we're measuring, and we're not getting the entire phenomena. And one of the reasons you want to get the entire phenomena is because you want to make sure that you're capturing what you think you're capturing. And that's construct or operationalization validity. Again, big words. So one of the things you want to do is make sure that you're really measuring what you think you're measuring. And one of the ways to do that is one of the things we call is face validity. So it's a legitimate measure. So how did they measure happiness in the past? And in the past, they measured it with education and income. Do you own a house? All of those things are great. You would include those. Construct validity is more looking at content validity, is looking at are we really getting the entire phenomenon? And the entire phenomenon of happiness is probably not just those things. So when we did this study again and we expanded it to include how close are you to your family, how much time do you spend with your family, how much vacation time do you have, how much maternity leave do you have, suddenly the United States was not in the top 10. We would move further down, and somewhere like Fuji moved way up because they lived next to each other, they had good health, they spent lots of time with each other, they had lots of vacation time. So suddenly they ranked much happier, only because we were expanding how we were measuring the phenomena of happiness to not just include monetary things, but to include social psycho things. Did we change the rankings in the study with the UN doing it? But we also captured the entire phenomena of what happiness really is. So you want to make sure that in your research design, you're really capturing, you're measuring things based on how the phenomenon is actually measured. And again, that lit review comes in really handy, but it sort of tells you how things were measured in the past. And sometimes one of the ways you come up with a research design is you expand how you measure and capture that phenomena, right? So if you're going to say, is a patient compliant with their meds, or are they staying on their diet? You might want to expand how you define that, right? Also is, how are we measuring it, and is it related to the way it's constructed in theoretical terms? And again, that lit review comes in really handy. One of the ways you really need to stop and think about how you're measuring what you think you're measuring in your research design is, if one person answers yes and the other person answers yes, are they answering yes to the same thing? We see this a whole lot. That's one of the reasons you see a lot of surveys, or you see a lot of information being very specific about what they mean. So one infamous example, and one thing that we see with pregnancy prevention programs with public health is if you ask people if they have sexual relations, you have to very much define what you mean by that, because infamously we had a president who said that they did not have a sexual relationship because they did not define it the same way. So in surveys you have to define what you mean by happiness, or what you mean by did you see an improvement in your affect, so that if I'm answering it, it's defined in a way that if I'm answering yes, someone else answering yes has got the same definition, because you're people that you're looking at, they're going to define it differently in their mind. So you have to make sure that it's uniform, and you have to make sure that everybody is answering yes to the same things. Again, that doesn't mean that you don't want to expand the definition and include different measures. We see this a lot when we ask people, everybody wants to support healthcare. Everybody wants to support more education, right? But then if you ask later on in the survey, are you willing to give or $10 more in your property taxes or $100 more every year towards that, you see that they don't really support it, right? Because they're having to actually do something, right? So that's expanding the definition of support. So some of the things you want to keep in mind when you're actually trying to operationalize things is, are you measuring what you think you're measuring? Are you getting the entire phenomena, which is content validity, and are you constructing in a way that you're really measuring things that you think you're measuring? I know this all sounds sort of convoluted, but again, your lit review will help you. They will talk about validity issues and how they measure things. So when you're looking at your research question and your potential hypothesis, how do you operationalize those things? Think it through. Think about the issues you may or may not have. Again, that lit review is really handy because you're going to see some people operationalizing things differently than others. If you're going to come up with a survey or a measure, make sure that everybody is understanding exactly what that is. This sort of conciseness and narrowness seems very constraining, but it isn't. It really helps you with showing your results and really understanding what you're capturing or what you're measuring and the outcomes that you're getting to see if your intervention is efficient, effective, if patient satisfaction is really what's happening. So things to think about, things to keep in